When performing a thorough patient history for a new canine patient, what are the key areas you must assess in the context of a physical exam, and why is it essential to gather detailed information on these areas? What legal or ethical considerations should be taken into account during this assessment? Answer: a complete patient history is critical to formulating a diagnosis and treatment plan. The key areas to assess include signalement, age, breed, sex, and reproductive status. Certain breeds are predisposed to specific conditions. Chief complaint: the primary reason the owner seeks veterinary care. Medical history: any previous diagnoses, treatments, surgeries, or hospitalizations. Medications: current medications, including dosages and frequency. Dietary history: type of food, frequency, and any dietary changes. Environmental history: exposure to toxins, other animals, or parasites. Behavioral history: any changes in behavior that may indicate medical issues. Ethically, veterinarians must ensure informed consent is obtained from the pet owner before proceeding with diagnostic or treatment plans. Legal considerations involve maintaining confidentiality of the patient's health information protected by the Health Insurance Portability and Accountability Act, HIPAA in the US. During a cardiac arrest situation in a critical patient, what are the main differences between basic life support (BLS) and advanced cardiac life support (ACLS) in veterinary care? Explain the steps involved in each process and how they work together in the resuscitation effort. Answer: basic life support (BLS) and advanced cardiac life support (ACLS) are two complementary steps in resuscitating a patient. BLS focuses on immediate life-saving measures like chest compressions and rescue breathing. For small animals, a compressed chest allows blood circulation, and for larger animals, this may require mechanical assistance. ACLS builds on BLS by adding advanced techniques such as endotracheal intubation, administration of emergency drugs, e.g. epinephrine, atropine, and electrical defibrillation when necessary. BLS should begin immediately upon recognition of arrest, while a CLS involves a higher level of care, often requiring specialized equipment and trained personnel. Both processes must be performed continuously until spontaneous circulation is restored, guided by protocols such as the American Heart Association (AHA) guidelines adapted for veterinary practice. When caring for a hospitalized animal that is recovering from surgery, what are the primary parameters you should monitor to ensure the animal's recovery is progressing as expected, and what signs of complications should you look out for? Answer: monitoring an inpatient recovering from surgery involves assessing vital signs, heart rate, respiratory rate, temperature, and blood pressure, pain levels, regular pain assessments using scoring systems like the Glasgow Pain Scale, hydration status, checking for dehydration or overhydration through clinical signs and laboratory tests. Wound healing: monitoring for signs of infection such as redness, swelling, or discharge from the surgical site. Behavior: observing for abnormal behaviors indicating discomfort or distress. Signs of complications include excessive bleeding, fever, sudden changes in behavior, or signs of septic shock. Monitoring should be continuous, and the attending veterinarian should be consulted if any abnormalities are noted. Legal and ethical considerations require documenting all observations in the medical record. Mr. White comes into your clinic with his cat, who has recently been diagnosed with chronic kidney disease (CKD). He is anxious about the prognosis and treatment options. How should you approach this conversation to ensure Mr. White fully understands his cat's condition and the treatment options available, while also addressing his concerns? What communication strategies are essential in this situation? Answer: in this scenario, it's important to use a clear, compassionate, and structured approach. Assess Mr. White's knowledge level. Begin by asking what he understands about CKD and clarify any misconceptions. Provide a detailed explanation of CKD, emphasizing the chronic and progressive nature of the disease, but also the potential to manage symptoms and improve quality of life with treatment. Discuss treatment options. Offer both conventional treatments, e.g. fluid therapy, dietary changes, medication, and possibly experimental therapies, and discuss the pros and cons of each. Address concerns. Mr. White may have emotional concerns. Acknowledge his feelings and provide supportive resources such as support groups or online communities. Clarify next steps. Outline a clear treatment plan and schedule follow-up visits to monitor progress. Effective communication strategies include active listening, empathy, and simple language, avoiding medical jargon. Documentation of the conversation is vital for ethical reasons and to ensure that all recommendations and client preferences are recorded. When formulating a diet for a critically ill animal, what factors must be considered to ensure nutritional support is both effective and safe? What are the implications of improper dietary management during critical illness? Answer: Several factors must be considered. Species-specific needs. Different species require different nutrient profiles, and their gastrointestinal system may respond differently to certain diets. Energy demands. Critically ill patients often have increased energy requirements due to inflammation, infection, or stress. Digestibility. The diet must be highly digestible to ensure nutrient absorption and minimize gastrointestinal distress. Protein requirements. Sufficient protein is necessary for healing and immune function, but excessive protein may put stress on the kidneys or liver in animals with pre-existing conditions. Hydration. Fluid intake is essential, and diet formulations must support hydration goals, especially in animals with renal or gastrointestinal disorders. Improper dietary management can lead to malnutrition, prolonged recovery, organ failure, or electrolyte imbalances, making careful dietary formulation and regular reassessments crucial. What are the ethical and legal considerations in euthanizing a patient, and how should you approach the decision-making process, particularly in cases where the owner is unsure whether to proceed with euthanasia? Answer: euthanasia is a highly sensitive decision that involves both ethical and legal considerations. Ethical guidelines. The decision should be based on whether euthanasia is in the best interest of the animal, ensuring that the animal's quality of life is no longer adequate and that it is experiencing suffering that cannot be alleviated. Client education. The veterinary team must explain the pet's condition, the prognosis, and treatment options clearly to help the owner make an informed decision. Informed consent. Legally, euthanasia requires the informed consent of the owner, who must understand the implications of the decision. Compassionate care. Providing support to the owner during this process is vital, and follow-up care and grief counseling may be offered. Failure to uphold ethical standards or act in the best interest of the animal can result in legal repercussions, such as charges of animal cruelty or negligence. What immediate steps should be taken when you receive a critically injured dog following a hit-and-run accident? How do these protocols align with current emergency care guidelines, and what legal considerations are there regarding the treatment of animals in traumatic situations? Answer: when receiving a critically injured patient after a traumatic incident like a hit-and-run, the following immediate steps should be taken. Ensure safety. First, ensure the area is safe for both the animal and the veterinary team. Assess ABCS airway breathing circulation. Perform a quick assessment to ensure the animal has a clear airways breathing and has adequate circulation. Stabilize. Control any external bleeding. Administer IV fluids and provide pain management. Diagnostic imaging. Once stabilized, proceed with X-rays or ultrasound to assess for internal injuries. Continuously monitor the animal for signs of shock or deterioration. Protocols should align with the American College of Veterinary Emergency and Critical Care (ACVEC) guidelines. Legally, veterinary professionals must ensure that any suspected animal cruelty is reported to authorities as required by law under animal cruelty statutes. What is the initial approach to managing a dog that has ingested a toxic substance, and how do you determine the appropriate treatment based on the type of toxin involved? What guidelines do you follow to ensure safe and effective treatment? Answer: initial management involves assess the situation, determine the toxic substance, the amount ingested, and the time elapsed since ingestion. Induce vomiting, if appropriate, and within 2 hours of ingestion, unless contraindicated by the substance. E.g., caustic substances. Administer activated charcoal. If appropriate, activated charcoal can absorb toxins in the gastrointestinal tract. Symptomatic treatment. Depending on the toxin, treatments may include intravenous fluids, antidotes, e.g., naloxone for opioids, or specific therapies like chelation for heavy metals. Consult poison control. Contact a poison control hotline, e.g., ASPCA Animal Poison Control Center, for advice on specific treatments. Guidelines include the ASPES Animal Poison Control Guidelines and the Veterinary Toxicology Protocols. Proper documentation of the toxin and treatment is essential for legal purposes, especially if the ingestion was intentional or due to neglect. What is the role of fluid therapy in managing a patient with both cardiac and renal failure, and what potential complications should be monitored during treatment? Answer: fluid therapy in patients with cardiac and renal failure must be carefully managed. The goal is to balance hydration while avoiding overloading the heart and kidneys. Key aspects of fluid management include: monitor fluid rate. Begin with a slow infusion rate and adjust based on clinical response, e.g., urine output, blood pressure. Types of fluids. Choose fluids that support renal perfusion, like isotonic crystalloids or balanced electrolyte solutions. Avoid volume overload. Watch for signs of pulmonary edema or congestive heart failure, as excess fluids can worsen these conditions. Electrolyte monitoring. Regularly check blood electrolytes to prevent imbalances, particularly potassium, sodium, and calcium. Potential complications include pulmonary edema, electrolyte disturbances, or cardiovascular collapse. What is the primary approach to managing a critically ill animal with sepsis, and how do you distinguish between bacterial and non-bacterial infections when selecting treatment? Answer: sepsis management involves early recognition, identify signs of sepsis including fever, tachycardia, hypotension, and altered mental status, fluid resuscitation, administer IV fluids to combat hypotension and improve organ perfusion, antibiotics, start broad-spectrum antibiotics and adjust based on culture results, supportive care, provide oxygen therapy, vasopressors if needed, and organ support e.g. mechanical ventilation, dialysis. Distinguishing bacterial from non-bacterial infections requires diagnostic tests like blood cultures or imaging. Treatment depends on the underlying cause, with bacterial infections requiring antibiotics and viral or fungal infections requiring specific antiviral or antifungal therapies. A veterinary technician is tasked with determining the nutritional needs of a new client's dog, a 4-year-old Labrador Retriever. The dog has moderate activity levels and is slightly overweight. What are the primary considerations the technician should take into account when formulating a balanced diet plan for this dog, and what general guidelines should be followed? Answer: the veterinary technician should consider the dog's life stage, activity level, and body condition when determining its nutritional needs. Labrador Retrievers are prone to obesity, so caloric intake should be adjusted to prevent weight gain. The primary considerations include life stage. Since the dog is an adult, its diet should be formulated to maintain its weight and prevent obesity. A maintenance diet is appropriate. Energy needs. The calorie requirements are based on the dog's weight and activity level. A general rule is to provide about €3, €4 kcal per pound of body weight per day, but this needs adjustment for weight loss, maintenance, or gain. Macronutrient composition. Protein should be about 1/8, €3% of the total diet, depending on activity. Fat content should be around 8.15% of the diet. Obesity management. To manage obesity, a high-protein, low-calorie diet should be formulated to promote satiety and lean body mass preservation. Essential nutrients. The diet should meet the dog's essential amino acids, fatty acids, vitamins, and minerals. A veterinarian suggests a client switch from a commercially available pet food to a home-cooked diet for their cat who has a history of kidney disease. What considerations should the veterinary technician discuss with the client regarding this transition? Answer: the veterinary technician should address several concerns before recommending a home-cooked diet for the cat, especially considering the kidney disease. Nutritional imbalance risk. Home-cooked diets often lack the complete balance of nutrients that commercial diets provide, especially for complex medical conditions like kidney disease. It is crucial to work with a veterinary nutritionist to ensure the diet is appropriately balanced. Nutrient needs. Cats with kidney disease may need reduced phosphorus, sodium, and protein levels, but increasing certain nutrients like omega-3 fatty acids, e.g. from fish oil, may be beneficial. A veterinary technician should ensure that the home-cooked diet is formulated to meet these needs. Vitamin and mineral supplementation. Commercial foods are fortified with essential vitamins and minerals. Home-cooked diets may lack these, necessitating supplementation. Consistent monitoring. The technician should emphasize the importance of monitoring kidney function through regular blood tests and urine tests to assess the effectiveness of the diet and adjust it if necessary. A veterinary technician is overseeing the treatment plan for a 5-year-old mixed breed dog diagnosed with obesity. The dog's current weight is 30% above its ideal body weight. What strategies should be implemented to address both the obesity and any potential malnutrition risks? Answer: the technician should adopt a comprehensive approach to managing obesity and preventing malnutrition. Weight loss plan. Implement a gradual weight loss plan that focuses on reducing the dog's caloric intake by about 1–2% below its current intake. The goal is to lose 1–2% of the dog's body weight per week to avoid muscle loss. Diet composition. Use a high-protein, low-calorie diet to preserve lean muscle mass during weight loss. Consider a prescription diet specifically designed for weight loss, which typically contains increased fiber to promote satiety. Exercise. Encourage moderate daily exercise to increase caloric expenditure and improve metabolic health. Nutritional support. Ensure the diet provides essential vitamins, minerals, and fatty acids to prevent malnutrition even during weight loss. The technician should monitor the dog's body condition score (BCS) and adjust the diet accordingly. Frequent monitoring. Regular veterinary visits are crucial to assess the dog's progress and adjust the treatment plan if necessary. Mr. Davis is the owner of a small veterinary clinic. He notices that his clinic's revenue has decreased over the past 6 months, and there is a noticeable increase in client complaints regarding wait times. He asks you, the veterinary technician, to assist in identifying and addressing the causes of these issues. What strategies would you recommend to Mr. Davis to improve client satisfaction and financial performance? Answer: several strategies should be implemented to address both financial concerns and client satisfaction. Client communication. Improve client communication to set expectations regarding wait times. The clinic could implement an online booking system or appointment reminders to streamline scheduling and reduce wait times. Operational efficiency. Conduct an internal audit of clinic operations to identify inefficiencies. This could involve evaluating the workflow from patient intake to discharge to ensure that the veterinary team is working efficiently. Staff training. Provide training for all team members on time management and client service. Training staff to handle client interactions better can improve the client experience and help manage wait times. Financial review. Conduct a detailed financial analysis to identify areas for cost cutting without sacrificing service quality. For example, inventory management practices may need to be reviewed to avoid overstocking supplies. Client feedback. Implement a system for regularly collecting client feedback to understand their concerns and address them proactively. A client brings in a dog diagnosed with arthritis. The client is interested in using joint supplements as an adjunct to the dog's treatment plan. What are the key factors the veterinary technician should consider when discussing joint supplements with the client? Answer: when discussing joint supplements, the technician should consider the following. Efficacy. The technician should explain that joint supplements such as glucosamine, chondroitin, and omega-3 fatty acids have been shown to provide benefits in reducing inflammation and improving joint mobility. However, the evidence may vary across individual animals. Regulation and quality control. Supplements are not regulated by the FDA in the same way as prescription medications. Therefore, the technician should advise the client to choose high-quality, reputable brands that adhere to manufacturing guidelines and are third-party tested for safety and efficacy. Dosage and administration. Discuss the correct dosage based on the dog's weight and the supplement's concentration. Overuse of some supplements can cause gastrointestinal upset, and adherence to recommended guidelines is important. Potential interactions. The technician should check for any potential interactions with other medications the dog is on, particularly non-steroidal, anti-inflammatory drugs, NSAIDs, as supplements may affect their efficacy or side effects. Monitoring. Regular follow-up visits should be scheduled to monitor the dog's response to the supplements and adjust the treatment plan as needed. A cat with chronic kidney disease is being monitored by a veterinary technician. The technician notices that the cat has a reduced appetite and weight loss despite following a kidney disease-specific diet. What are the possible causes of the cat's poor appetite and weight loss, and how should the veterinary technician address this issue? Answer: several factors could be contributing to the cat's poor appetite and weight loss. Disease progression. Chronic kidney disease, CKD, can lead to uremia, which causes nausea and a reduced appetite. The technician should work with the veterinarian to assess the progression of the disease through blood work, including blood urea nitrogen bun and creatinine levels. Dietary preferences. Cats with CKD may develop aversions to certain foods, particularly if the diet is not palatable. The technician should suggest trying different flavors or textures of kidney-specific diets or using appetite stimulants under veterinary guidance. Concurrent conditions. The technician should consider other potential conditions such as dental disease, gastrointestinal issues, or pancreatitis, which could impact appetite. A thorough examination and possibly additional diagnostic tests should be conducted. Feeding techniques. Encourage the client to offer small, frequent meals and consider using a feeding tube if the cat's condition deteriorates and oral intake is no longer sufficient. A veterinary practice is considering implementing a new financial budgeting system to track expenses and increase profitability. What steps should the veterinary technician recommend to ensure the system is effective? Answer: the following steps should be taken. Establish clear financial goals. Set specific financial goals for the clinic, such as increasing revenue by 10% or reducing overhead costs by 5%. These goals will guide the budgeting process. Track income and expenses. Implement a system that tracks income from services and products sold along with fixed and variable expenses. This can be done using accounting software tailored to veterinary practices. Monitor cash flow. Regularly review cash flow statements to ensure the clinic can cover operational costs and invest in improvements. Timely collections of payments from clients and controlling expenses are essential. Cost-cutting strategies. Review all overhead costs, including staff salaries, utilities, and supplies, to identify areas where expenses can be reduced without compromising quality of service. Regular budget reviews. Monthly or quarterly reviews should be conducted to ensure the practice is on track to meet its financial goals, making adjustments as necessary based on performance. A veterinary technician is asked to manage client communication for a clinic undergoing changes in service pricing. What is the best approach for handling the communication with clients about price increases, and what key messages should be included in the communication? Answer: the technician should adopt the following approach. Transparency. Clearly explain the reasons for the price increase. This could include rising costs for medical supplies, higher operating expenses, or investments in better equipment and staff training. Advance notice. Clients should be informed well in advance of the price changes, allowing them to plan financially and ask questions. This can be done through direct communication, emails, phone calls, and clinic newsletters. Value explanation. Emphasize the quality of care provided and how the price increase will help maintain or enhance that quality. It's important to reassure clients that the price change is necessary to maintain high standards of service. Client appreciation. Acknowledge and thank clients for their continued support. Offering loyalty programs or discounts for multi-pet households can help maintain goodwill. Clear and empathetic communication will help build trust with clients during price adjustments, as recommended by the AVMA. How can a veterinary technician contribute to creating a strong team dynamic within a veterinary clinic? What specific strategies can be used to improve communication and collaboration among staff members? Answer: the veterinary technician can implement the following strategies. Team building exercises. Regular team building activities can improve communication and trust among staff. These could include both work-related and social events that foster teamwork. Cross-training. Cross-train staff on various roles within the clinic so that they understand each other's responsibilities and can support one another more effectively. Open communication. Encourage an open-door policy where staff members feel comfortable discussing issues and ideas with management. Regular team meetings can be used to address concerns and brainstorm solutions. Feedback and recognition. Provide constructive feedback regularly and recognize team achievements. Acknowledging hard work motivates staff and improves overall morale. Guidelines from veterinary practice management organizations like the AVMA stress the importance of a collaborative and communicative work environment to ensure high-quality patient care. A veterinary technician notices that inventory turnover for medical supplies is slower than expected, leading to overstocking and waste. What actions should the technician take to address this issue and optimize inventory management? Answer: the technician should take the following actions. Inventory assessment. Conduct a thorough inventory review to determine which supplies are overstocked and identify slow-moving items. This can be done using inventory management software. Stocking limits. Establish stocking limits for each product based on usage trends and lead times for ordering. Set up automatic reorder points to maintain optimal inventory levels. Waste reduction. Implement strategies to reduce waste, such as rotating stock to ensure older products are used first and donating unused products before their expiration dates when appropriate. Vendor management. Review supplier contracts to negotiate better terms for bulk purchases or delivery schedules that align with the clinic's needs. Veterinary guidelines for inventory management emphasize efficiency, cost effectiveness, and waste reduction to maintain profitability and reduce unnecessary expenses. You're assisting with a blood draw for a canine patient. The veterinarian instructs you to choose the best site for venipuncture. Which of the following factors is most critical when selecting a site for venipuncture in a dog, and what are the key considerations for successful blood collection? Answer: when selecting a site for venipuncture in a canine patient, the most critical factor is vein size and accessibility. The following considerations must be taken into account. Vein size. Larger veins, such as the cephalic or jugular veins, are often preferred as they are easier to locate and provide a more significant blood sample. Location. The site should be easily accessible and well lit, allowing for proper visualization. Patient's condition. Consideration of the patient's comfort and stress level is important. In a stressed animal, peripheral veins might be more difficult to palpate. Patient size. Larger dogs may present a different set of challenges than smaller dogs. For example, the jugular vein may be more easily accessible in larger breeds, while smaller breeds may require more precision and caution with needle placement. A cat is diagnosed with chronic kidney disease (CKD) and prescribed an angiotensin-converting enzyme ACE inhibitor for blood pressure management. What is the mechanism of action for ACE inhibitors in the treatment of CKD, and why is this medication specifically chosen for this condition? Answer: ACE inhibitors such as enalapril work by inhibiting the angiotensin-converting enzyme, which plays a critical role in the renin-angiotensin-aldosterone system. ROS by inhibiting this enzyme. ACE inhibitors reduce the production of angiotensin II, a potent vasoconstrictor. This results in vasodilation, lowering systemic blood pressure and decreasing the workload on the heart and kidneys. Additionally, the inhibition of aldosterone secretion prevents sodium and water retention, further reducing blood pressure and fluid buildup. While chosen for CKD, in CKD, the kidneys are often unable to filter waste and regulate fluid balance effectively. ACE inhibitors are particularly beneficial because they help control the hypertension that is common in CKD patients, reducing the risk of further kidney damage and managing proteinuria, protein in urine. This leads to a slower progression of kidney disease and improved quality of life for the animal. When performing an abdominal ultrasound on a 7-year-old cat suspected of having pancreatitis, what are the key features you should look for in the imaging to support a diagnosis, and how do you distinguish these from normal findings? Answer: in an abdominal ultrasound for pancreatitis, the following features are significant. Pancreatic enlargement. The pancreas may appear enlarged, hypoechoic, dark, and heterogeneous, as opposed to a normal, well-defined, homogeneous appearance. Hypoechoic fluid. A fluid pocket around the pancreas or in the peritoneal cavity may indicate peritonitis, a common complication of pancreatitis. Changes in surrounding tissues. The presence of gastric and small bowel changes, such as thickened walls or reduced motility, may suggest inflammation extending from the pancreas. Distinguishing from normal findings. In healthy cats, the pancreas is typically small, triangular, and echogenic, bright if there is echogenicity, or a well-defined texture. It suggests inflammation or edema rather than a normal, healthy structure. Mr. Thompson's dog, Max, has been in a fight with another dog and sustained a large laceration on the left hind leg. After cleaning and debriding the wound, you are preparing to apply a bandage. What steps should you take to ensure that the bandage will be effective in promoting healing and preventing further injury? Answer: when bandaging a wound, it's important to follow these key steps. Clean the wound before applying any bandage. Ensure that the wound is thoroughly cleaned with a mild antiseptic solution, e.g. chlorhexidine, to prevent infection. Sterile dressing application. Apply a sterile dressing directly on the wound to prevent contamination and absorb any exudate. A non-adherent dressing, e.g. Telfapad, is ideal for this purpose. Padding. Apply soft padding, e.g. gauze roll or cotton around the wound to absorb drainage and provide protection, securing the bandage. Use a self-adhesive bandage such as vet wrap or gauze to secure the dressing in place. Be sure not to apply it too tightly, as this can impair circulation. Check for complications. After the bandage is applied, check regularly for any signs of excessive swelling, discoloration, or odor which could indicate infection or poor circulation. Proper bandaging is critical in preventing further trauma and supporting the healing process. During post-operative recovery of a dog, what vital signs should be monitored, and how do you assess the dog's recovery from anesthesia? Answer: post-operative recovery involves close monitoring of the following vital signs. Heart rate and rhythm. Tachycardia or bradycardia could indicate either shock or anesthesia residual effects. Respiratory rate and effort. Shallow or labored breathing can indicate hypoxia, while deep, irregular breathing might suggest residual anesthetic effects. Body temperature. Hypothermia is a common side effect of anesthesia if the dog's temperature drops below normal. 3738 warming measures should be implemented. Oxygen saturation. Pulse oximetry. Ensure the dog is receiving adequate oxygen levels, typically above 95%. Pain assessment. Nonverbal pain indicators such as panting, restlessness, or abnormal vocalization must be monitored to ensure effective pain management. Recovery signs. Ensure the dog regains full consciousness, normal limb movement, and stable vital signs. MS. Parker has brought in her 10-year-old Labrador Duke for a routine dental procedure under general anesthesia. The veterinarian plans to use propofol for induction. What concerns should you have about using propofol in Duke, given his age and breed, and what measures should be taken to ensure a safe anesthesia experience? Answer: concerns about using propofol in an older dog like Duke. Age-related risks. Older dogs often have reduced liver and kidney function, which may affect the metabolism and clearance of propofol. This could increase the risk of prolonged sedation and respiratory depression. Breed predisposition. Certain breeds, like Labradors, can have a predisposition to obesity and heart disease, which can complicate anesthesia management. Pre-anesthesia assessment. Conduct a thorough pre-anesthetic evaluation, including blood work, renal and hepatic function electrocardiogram and a physical exam to assess heart and lung function monitoring. During the procedure, use continuous monitoring of vital signs, heart rate, blood pressure, respiratory rate, oxygen saturation, and be prepared for any changes in Duke's condition. Ensure the ability to provide emergency resuscitation if needed. After spay procedure, what post-operative care should be provided to ensure proper wound healing, and how can you prevent infection or complications? Answer. Post-operative care includes the following steps. Wound monitoring. Check the incision site regularly for signs of infection, including redness, swelling, heat, or discharge. Preventing infection. Keep the wound clean and dry. Use an Elizabethan collar to prevent the dog from licking or biting at the incision site. Pain management. Administer prescribed analgesics and monitor the patient for signs of discomfort or pain, which could hinder recovery. Activity restriction. Limit the animal's activity for 1014 days to prevent strain on the wound and ensure proper healing. Antibiotics. If prescribed, ensure that the animal completes the entire course of antibiotics to prevent infection. A dog presents with lethargy, pale mucous membranes, and an elevated heart rate. The hematology results show a low P, CV, packed cell volume, and a normal reticulocyte count. What is the most likely cause of this anemia, and what further diagnostic tests would you recommend to confirm the diagnosis? Answer. The most likely cause of anemia with a normal reticulocyte count is non-regenerative anemia, which indicates that the bone marrow is not producing enough red blood cells. This could be caused by chronic disease e.g. chronic kidney disease, inflammatory conditions, iron deficiency, bone marrow disorders e.g. myelofibrosis, neoplasia. Further diagnostic tests, serum chemistry and renal function tests to evaluate for kidney disease. Bone marrow aspirate or biopsy to assess bone marrow function and rule out hematologic malignancies. Iron studies, serum iron, ferritin, total iron binding capacity to assess for iron deficiency. Coagulation profile to rule out bleeding disorders as a contributing factor. A cat recovering from surgery is not eating and requires nutritional support. The veterinarian recommends placing an esophagostomy tube. What are the advantages of using an esophagostomy tube over other types of feeding tubes, and what are the key considerations for its care and maintenance? Answer. Advantages of an esophagostomy tube. Long-term use. Esophagostomy tubes are more suitable for long-term feeding compared to nasogastric tubes, which are typically used for short-term support. Improved patient tolerance. These tubes are placed directly into the esophagus and are less likely to cause discomfort or irritation than nasogastric tubes. Better access to nutrition. Esophagostomy tubes allow for a larger diameter, making it easier to administer thicker or higher calorie diets. Care and maintenance. Tube cleaning. The tube should be flushed with warm water after each feeding to prevent clogging. Preventing complications. Regularly check for signs of infection at the insertion site, such as redness, swelling, or discharge. Monitoring placement. Ensure that the tube remains correctly positioned to prevent aspiration of food into the lungs. Feeding protocol. Follow the prescribed feeding protocol, ensuring that food is administered in small, frequent amounts to avoid overloading the stomach and causing regurgitation. A 5-year-old Labrador Retriever is undergoing surgery under general anesthesia, and the veterinarian is using isoflurane as an inhalant anesthetic. What are the primary advantages of using isoflurane, and how does it compare to other inhalant anesthetics like sevoflurane or halothane in terms of safety and recovery? Answer. Advantages of isoflurane. Cardiovascular stability. Isoflurane provides good cardiovascular stability, making it ideal for use in patients with underlying heart conditions or those undergoing lengthy surgeries. Rapid induction and recovery. Isoflurane has a fast onset and rapid recovery, allowing for better control over anesthetic depth and quicker recovery post-surgery. Non-irritating to airways. Isoflurane is less likely to irritate the airways, making it suitable for use in patients with respiratory conditions. Comparison to other inhalants. Sevoflurane. Sevoflurane is known for its rapid induction and recovery time similar to isoflurane, but it is often less irritating to the airways, which can be beneficial in pediatric or respiratory compromised patients. Halothane. Halothane is more potent than isoflurane but carries a high risk of hepatic toxicity and arrhythmias, making it less commonly used in modern veterinary anesthesia.